Persistent opioid use trajectory before and after cancer. Do one-size-fits-all policies fit? 41 people die every day from prescription opioid overdose in the US, and opioid-related deaths have increased 28% since 2015 nationwide. Sadly, this opioid crisis is still around us, despite their risks of adverse effects like addiction and physical dependence. Opioids continue to remain a substantial therapy to treat both non-cancer and cancer pain. Scientists realized that persistent use of opioids could be triggered not only physiologically, but also psychologically. Essentially, the human brain learns that opioids reward satisfaction to the pain receptors rather than merely acting as painkillers. Since elderly population are so prone to chronic pain conditions such as low back pain, joint pain, headache, and many others, they're the most vulnerable age group to this opioid use. Studies showed that during the cancer treatment period, individuals with chronic pain conditions may require higher doses of opioids. For a longer term, due to the pain, the drug desensitization. The question is, before and after cancer, what opioid use trajectory patterns exist? And if there's a persistent use trajectory pattern, what factors are associated with it? In my study, I utilized a national data set of about 35,000 older adults aged 65 and above, diagnosed with either non-Hodgkin lymphoma, breast, prostate, or colorectal cancers. We analyzed the repeated opioid use measurement data every 3 months for 3 years, 1 year before and 2 years after cancer diagnosis. Using group-based trajectory modeling, we analyzed the distinct trajectory of opioid use in this population. Our research objectives are to identify opioid use trajectory patterns and characterize factors associated with the persistent use of opioids over time. We identified 4 distinct trajectories of opioid presented on my slide: increase-decrease use, short-term use after cancer diagnosis, low use, and persistent use. We found that 1 in 8 older adults had persistent opioid use over time. Furthermore, the characteristics of this group differed from the other groups. Social determinants of health such as race, in this case, African American, and residential rurality were among the factors associated with being persistent opioid users. A similar associations also exist among people with anxiety and non-opioid drug use prior to cancer diagnosis. This study clinically implies that one-size-fits-all policies may not fit in reducing chronic opioid use, and we are proposing to policymakers to consider the individual's variabilities in clinical decision making to reduce the opioid use long-term in the US. Thank you so much.